Thank you for staying with Your World. My name is Gladys Gachanja. In this hour, we talk about how to safeguard our informal settlements. I have key stakeholders with me in studio, and that will be Hilary Omala, who is the Executive Director at the Carolina for Kibera, which is now abbreviated as CFK, and of course, Anne Kongo, who is the Partnerships and Fundraising Manager at CFK. Thank you for joining us on this conversation. And I'll start off with you, Hilary. I mean, it's been many years of Carolina for Kibera at work on the ground. So give us some background on who CFK is.
Thank you very much, Gladys, for having us in studio, and good morning to our viewers. So Carolina for Kibera, or CFK as we are commonly known these days, is a 2,000 Kenya shilling story of an encounter between three wonderful individuals that happened in 2001. So two Kenyans, the late Tabitha Festo, Salim Mohammed, and an American named Rai Bakot, who was a student at the University of North Carolina at the time. And so Tabitha Festo had encountered health inequity firsthand as a widow and a nurse who had been retrenched by government at the time. And perhaps she realized that government and other big players in the healthcare sector were not scaling up fast enough to meet this challenge in the informal settlements. And so she reached out to Rai Bakot and asked for a favor, which was basically a small amount that would help her start a vegetable vending business, raise enough capital to bring affordable healthcare in the informal settlements of Kibera. Rai Bakot reluctantly gave her 2,000 Kenya shillings, which was the equivalent of about $26 at the time. And with this money, she started the business. Rai had left, forgotten about this, but kept in touch via email. It was the only form of communication at the time. Within 2 years, Tabitha Festo had already set up a small clinic within her house in Gatwekera village in Kibera. Rai had followed this intriguing story and decided to go back, raise enough money, come back here in Kenya, and in 2003, together with Salim Mohammed, who he had met in Mathare, they decided to start an initiative, and they would call it Carolina for Kibera, meaning the people of North Carolina giving support to those who lived in Kibera at the time. Salim did not only become the founding executive director at the time, he also started the second initiative, which was Sports for Development. And the idea behind this program was to use sports as a tool of mobilizing young people who would come together, play soccer as a popular sport. And while doing so, they will cultivate peace, ethnic cohesion, and collaboration among the communities within which they lived. Those two flagship programs, the Sports for Development program, the Tabitha Medical Clinic started by Tabitha Festo, were the firm foundation upon which the growth of the organization has been based. And 20 years down the line, we now have very significant initiatives around primary health care, girls and women empowerment, education and livelihoods. And just recently, we refreshed our mission statement and developed another 5-year strategic plan taking us through to 2025. And this plan focuses our attention on the improvement of public health care services and economic prosperity in informal settlements in Kenya or potentially beyond Kenya.
Okay.
We are headquartered at the Binti Pamoja Center in Kibera, and we are also an affiliate program of the University of North Carolina. So we have an office there and also registered as a 501c3.
Okay. Now, when we talk about inequities, they are across board, but why the informal settlements, Anne?
Now, with urbanization, we saw a rapid growth in towns within different countries. We've also seen an influx of population coming in. So based on off of data, we know that almost 50% of the world's population lives in cities. And within those cities, the informal settlements that are within the cities, they host 25% of the world's population. So basically 25% of everyone in the world lives in one way or another in some form of an informal settlement. Now, with that backdrop, coming down to Kenya itself, we have over 1,000 informal settlements. A good example is just Mombasa it has over 50 informal settlements.
Oh, wow.
So now you are thinking, with such a high population living in such communities, with all the vulnerabilities, as you've mentioned, that are there, so why not focus on those informal settlements? And for, as CFK, as Hilary has mentioned, we've been in Kibera for 20 years. There's a lot of diversity in terms of the kind of people that are there, the challenges that are there. So it has allowed us to really understand, with such a complex setup, how to handle the challenges in informal settlements. So the one thing we're sure of is, wherever we go, as long as it's an informal settlement, we have one way or another established what would work.
Okay, so you talk about the complexities, you know, therein. So which are these, and what are the status, or what is the status of informal settlements as we speak?
The status of informal settlements right now is in twofolds. They are growing in numbers, in terms of how many, quantity of informal settlements, that will grow. And also the numbers of people within the informal settlements, they will grow. Going back to the issue of data, it was projected that by 2030, so the population of people living in cities will grow from 50 to 60%. That's 10% is a lot of people if you consider the entire world population. And basically what you're thinking also is with devolution. We have a lot of new cities that are popping up, new towns. And obviously that comes with its own advantages and opportunities. So we will continue to see more people moving into the cities. And as they move into the cities, they're coming in for opportunities. So that means more or less they probably do not have the finances to find a comfortable home. So the options are either A, move into an existing informal settlement, then it grows. Or over time, they will congregate near where the main town is, and thereby now forming new informal settlements. So what we know for sure is they will grow. So what do we need to do as organizations and different institutions that are focusing around issues of community development with this in mind? So we need to shift our methods of thinking and approaching, where we are trying to see how do you provide infrastructure and services within these communities, and putting in mind what is going on. A good example is currently with NMS. They've put up a number of informal settlements under the special development planning, special planning program. So what is happening is that they will see an increase, even in Kibera we've seen that, an increase in number of roads being constructed, hospitals being opened. So a good example is Kibera. A couple of villages in Kibera are under NMS, the special planning. Mukuru, Kwajenga, Mukuru, Kwa Ruben, and Viwandani. So the 4 informal settlements are going to, so we are likely to see a bit of development, but also we need to think about what about the other informal settlements, what will be done.
Now development comes with a lot of finances involved. So how much do you think has gone into this? Because 20 years is a long time, and of course you talked about the iniquities that these informal settlements actually face.
Definitely, and given the numbers that my colleague Anne has shared, if you're talking about 1 billion potentially living in informal settlement and a projected growth to probably 3 billion by 2050, and Kenya is not an exception. We are currently talking about over 1,000 informal settlements across the country. And as we continue to urbanize, counties continue to develop, definitely there will be growth either in number or sizes of those informal settlements. Definitely you need millions to be invested in these informal settlements to make sure that the people who live there have a better life.
And you talked about access to health, schools, boosting of informal settlements, economies. How have you been able to do so?
So we have measured in various projects. There is access to healthcare. And I will tell you for a fact that has improved a lot across informal settlements in the country. Talk about access to education. Informal settlements could potentially have the highest enrollments in this country and major towns across the city. Talk about issues to do with sanitation. Just 10 or so years ago, what we call flying toilets was very rampant. And I remember those days when you are getting to a duty station, we used to call them landmines. And you had to walk extremely carefully, lest you step on one, have it explode and ruin your day. And those would also lead to the spread of diseases, including cholera, and you would see so many cases of those across those places. But the greatest of all these things, I would say, is the change in mindset. When people move into informal settlements, they always feel like it will be a temporary residence for them. Life would get better, I would move out of the informal settlements and start a better life elsewhere. That's the wish that all of us have for these brothers and sisters, but sometimes it can take a very long time to make that change. Initially, when you talk to people and ask them to join you in efforts towards improving where they live, there was a lot of hesitancy. But nowadays, they value this as their home and they are willing to participate in development. I wouldn't attribute all those changes and the good outcomes to just the work that CFK does. We are many players in that sector, but I'm very proud that we have played a very big role towards making sure that there is better change.
Okay, now great strides done in the 20 years you've been in Kibera, but of course we are living within a pandemic and we all know the impact of the same on each of our lives. So how has this affected the informal settlements, Hilary?
I would let my colleague Anne share a bit of how those effects.
Okay.
So I would say in terms of COVID, what it has done is just to compound existing vulnerabilities and inequalities. So we will not say that beyond the health challenge that COVID has brought to the lives of people within these communities, the side effects of this is that it has just compounded. So there are already existing vulnerabilities and inequalities, so they've just increased. A good example is issue around healthcare. As Hilary has said, there were challenges with healthcare prior to COVID, but now there was a dire need for continuous access. A good example is how we noted that there were not enough beds for admission. So access to healthcare has been compounded. When it comes to education, we have enough challenges in education going on, but with COVID, they were compounded. So just various things that exist, gender-based violence, child labor, child marriages, basically just unemployment. We all felt really the blow that it really blew when it comes to issues of unemployment. So basically, compounding is what COVID has really done. Yeah.
And we are underscoring healthcare because we are in a pandemic and it's a healthcare crisis all over the world. Hilary, how does CFK model fill the gaps in accessing healthcare in these informal settlements, especially in the face of a pandemic?
I would say ours is what I would call a complete cycle in the continuum of care. So you're looking at an integrated healthcare system that runs from the household level to the facilities, and not just our very own facilities. Now we have 4 in Kibera and potentially planning to set up several others elsewhere. But that complete cycle where you have the community, someone attending to you, and these are community health volunteers making referrals to facilities, emergency care in good time, and also feedback system, making sure that you follow up on those people that you serve and making sure that they're doing well.
Okay. Now, still with the pandemic, I'm just wondering, you mentioned gender, early marriages, gender violence, that is early marriages, also some of issues that have come up or have been exacerbated by the pandemic. On how have you come to meet the needs of the women and girls in the informal settlements?
When it comes to issues of women and girls, our unique approach is that we focus on creating a healthy and encouraging and supportive ecosystem around women. Because what we need to shift the mindset is from viewing that issues of gender-based violence are not really issues of women, but it's a community issue. So if you want to support the women who oftentimes are the most disenfranchised and most vulnerable within a community, so how do you focus on building a healthy ecosystem? A good example is we have a program that specifically focuses on issues of adolescent girls and young women. So what we're doing is, the first approach is how do you inculcate their voice and data into informing the program? So the girls, yes, are the ones who are to benefit, but you can imagine she is the one who has lived through the vulnerabilities, the stigma, the challenges of gender-based violence. So she is better placed to tell you what she thinks works for her. So you have to build in their voice, which is something that we do that intentionally. About 3 to 4 times a year, we sit down with the girls, evaluate the program. What do they think? What do they feel? What are we missing? Number two is issues of also readdressing, for example, at the school level, menstrual hygiene maintenance, menstrual hygiene management, the education, the supplies that are needed. What we need to do now is to reevaluate that supply chain. The government has done a great job in providing sanitary towels for girls for free. But now what we had not anticipated, for example, is COVID. Schools were closed. Every single pad used to be distributed and is still being distributed at school. But the schools were closed. So where were the girls to get? So we have to understand that last year, for a large portion of that year, most girls who rely on these sanitary towels from schools had nothing, because the only supply chain is through the school. So a good example is even at CFK, we realized that there was a huge number of girls who are now coming to us that previously never used to come to our doors to request for sanitary towels. So you have to give them. Going back also to issues of parents, how do you increase their capacity and get them more involved in issues of girls? Because what we realize is parents are busy now, especially with the kind of communities we work with. So it's really quite easy to drop a few things along the way because of the hustles and bustles of life and just meeting the needs of your children. So how do you get them into the culture of being a bit more intentional and being more attentive when it comes to issues that their children are going through? Issues of teen pregnancy, as we said, there needs to be really a shift in sensationalizing it and into really addressing the root causes. So what are the root causes? For us, we really have built in issues of data collection into that. So we understand why are our girls getting pregnant? And I'll just tell you off the back of a few surveys we've done over the last 3-4 years. We noticed that number one is the lack of school fees. So schools are a really important safe haven for adolescent girls and young women. So they need to be in school. And when they don't have school fees, they're at home, they're idling, that's how she gets pregnant. Number two, another challenge that was really a causant or really a stimulant to teen pregnancy is issues of parental engagement. So the girls feel neglected, so they go and look for comfort elsewhere. And also things like lack of supplies for schools and other minor things that also basically that they're challenging. So we need to be more intentional when it comes to addressing root causes. And also there is what currently exists, measures, the return to school policy that the government has put in. It's been built into a couple of other policies like the gender policy, among others, that ensure that when girls get pregnant, they stay in school, and after delivery, they return to school. But what that policy does not address is the burden of care that teen pregnancy comes with. The girl gets pregnant. She has a baby. It is a reality that you must deal with. The girl cannot go to with the baby to school. So how do we address that within the school, within the community? So basically what we would love is, we had an advocacy project around that, and we've gotten about, there were 4 schools within Kibera. They set up ECDs inside the school.
Okay.
So now the lovely thing is the girl can go to school. Even at 3 months, she can go back to school. And she has her baby within the compound, and she can continue to breastfeed. I feel like that was one of the most wonderful achievements as CFK we got in 2019.
Yeah.
The same program, we were able to take back about 450 girls, teen moms, back to school. Some of them being out of school for more than 4 years. Now, going back to the question, another thing that we also need to do is build in an aspect of male involvement. How do we get our boys, our men, our fathers to be a part of empowering girls and women? So it's just issues of redefining gender roles, redefining the man's role within the house, taking away issues of power and control from the conversation. Because if we do not have that, then there is a bit more space and an enabling table for us to have conversation on how we can all be equal within the community and within our households. So those are some of the various ways in which we support issues of women and girls. But the greatest, I feel, something new that we are coming up currently with, we're in the pilot phase, is issues of gender-based violence. So generally in Kenya, the worst performing indicator in terms of minimum package, minimum services that a survivor of gender-based violence receives, the worst performing is issues of psychosocial support. So the counseling, the therapy. The reporting has improved significantly. Going to hospitals has improved. But psychosocial support is what lacks. And you know, with gender-based violence in any form, it comes with trauma. And if that trauma is not addressed, it has ripple effects, not only on the woman, and also we recognize that the men go through that as well, but it has ripple effects on your children, your family. So psychosocial support is what we are really focusing on for the next couple of years. And we have come together with Adele Onyango. We've developed a project known as Safe 247. It's a group therapy specifically for survivors of sexual violence. We have shifted away from what is usually about 4 to 5 counseling sessions. And instead, we are doing 15 sessions. And what we are doing is we are using the group basically to create a sense of sisterhood among the women. So you have 15 women, 10 to 15 women you will work with. And you will address issues of trauma. You will build your capacities to deal with triggers. And eventually, after transitioning out of the project, after the 15 weeks, you retain the network. You have tools to deal with any triggers that you experience. So generally, just how do we support generally across board, creating a system and a network within a community.
All right. And clearly, empowerment is at the core of what you do. Hilary, before I take a short break, education is at the core of that business. So how are we ensuring, especially in the pandemic, there is a lot of reports of school dropouts, and this is affecting both male and female. How are you meeting this need?
That has been a huge challenge, and not just in informal settlements, but across the country. And last year or the year before, you saw so many reports of teenage pregnancies, very high, especially in the coastal areas of Kenya and other counties across the country. And this often leads to school dropouts. And you attribute to this many things that Anne, my colleague, has talked about in terms of participation of everyone, including parents. CFK has played a very key role in making sure, one, there is access, but is also retention in those schools and giving the support that people need, especially in what we call informal settlements that are not currently being recognized by government. So other than just focusing on public schools, we also have informal settlements. Given the pressures that the public schools have in informal settlements, a lot of parents have opted to go to these ones, and you need to focus on those ones and make sure that our children learn and they receive quality education.
And what's the impact of the economic shift on the parents in a pandemic or now the education retention, so to speak, Hilary? Or would you like to take the question, Anne? Okay.
So what we saw is a lot of loss of income in the households.
Yes.
Number one, the first challenge that provides is issues of mental health for the parent, because what you're doing is you've lost the income. So an interesting thing we need to realize with informal settlement is that a majority of the caregivers rely on these informal sectors to earn an income. And the earnings are very low and very regular, so not very consistent. And also you realize for informal settlements, about 50% of an entire household's budget goes to food. So with COVID, you've lost all your employment. So the one thing you're sure of is there's no food. And then number two, we have to also think back when you're thinking about children, is think back about schools. Schools have been closed. Schools that have feeding programs. So the kids are at home. The parents don't even have enough money to feed them. And the schools that are the savior with the feeding program, so at least lunch you knew you'd get something, are closed. So no feeding program. So now what we have is a child who's at home, who is forced either to reduce in terms of quantity of the food they have or the quality. And none is good for you. Quantity, quality in terms of food, it matters. That's nutrition. So now we are risking the health of our children through this pandemic. Another effect when it comes to that education has had, as Hilary may have mentioned, is issues of idleness. This got our kids engaged in risky engagement relationships. So now the teen pregnancy comes in. And another thing that we need to address is issues of also SDGs that we have to think about. Education is a big factor when it comes to the SDGs. When the countries, the world came to a stop, the SDGs also slowed down because we all shifted our focus on health. All the other indicators, more or less, unintentionally, were put on hold. Education as well. So what we are thinking about is how will that be affected? I was reading up on some research, and what I've noticed is you'll notice that 1 out of 6 girls in January did not return to school. 1 out of 12 boys did not return to school. So twice as many girls did not return to school as boys. And basically also you have to realize, even with continuity of learning, we were talking just I think a couple of weeks ago on how that has affected what was affected during COVID. And we have kids who are at home idle. For the few that are lucky that had access to devices, internet, they had some continuity of learning, so you engage your child, they're not idle. The kids in the informal settlement had none of that. So they only had nothing but idle time to spend time on. However, as CFK, we did try to mitigate that to some extent, where we would print out reading or learning materials and just distribute. So the parents would pick them up and then engage the kids. So over and above, education was affected, the calendars shifted. So what we need to think is really, again, readdressing our systems, readdressing what is available for our children.
All right. So Carolina for Kibera, CFK now has been making a difference in the informal settlements of Kibera, as you've heard. So what is the impact of the work 20 years on? We find out in a moment. Stay with us.
Fresh fried ginger has ginger oil, which is good for a healthy living lifestyle. It combines wonderfully on salads, stir fries, when basted on roasted meat, or simply sprinkled on your favorite dish. Now available in 250 ml, 500 ml, and 1 liter.
I mean, that's it. Is there corruption in the judiciary?
Corruption is the biggest problem facing the judiciary. Lifestyle audit. I mean, they are judged with huge properties.
Integrity training has to start very, very early. It's a societal problem.
Where does a judge get money to buy a mall?
Perhaps he's a good judge.
No.
He's an excellent judge.
We know all the salaries is from 500 to 1 million shillings, you know. The government is not fighting corruption when it arrests the judge. It's fighting a political war. We are so tired, we are so desperate about corruption at all levels that we don't know, what to do next.
Kwetu Mix in association with Coca-Cola.
Introducing Kwetu Mix.
Okay, but don't need no intro.
Tangu tuingie kwa mchezo sindo heartbeat. Nairobi City tunairan kama heartbeat.
If you know, you know.
We have a bang.
Nisho, ni wapi uliniona?
Kwetu Mix on MTV.
Tutakuletea updates zote about all the trendy and popular entertainment events. Yes, man.
Kwetu Mix, keep it locked, NTV, don't touch the dial.
Kwetu Mix in association with Coca-Cola.
NTV jioni, habari za kina, fasaha, tendeti na za kuaminika.
Can you get yourself inside my room? Let me take you up. Let me take you down. Let me show you up. Let me turn you on. Let me show you some good lo 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 lo. Lo 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 lo. Let me show you good lo 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 lo.
To get Lolo by Omar Lay, dial star 812 804 hash. Skiza, Nan Nation.
Lucozade. Energy to get through it.
Just one capful of Dettol is enough to disinfect surfaces and protect your family and your home. Dettol, tested effective against COVID-19.
This
Thank you for staying with Your World. My name is Gladys Gachanja. We are focusing on how to safeguard our informal settlements. Helping us along with this is Hilary Omala, Executive Director, CFK, and of course, Ann Kongo, who is Partnerships and Fundraising Manager, CFK. If you're wondering who CFK is, Carolina for Kibera, and they now have rebranded to CFK. And when we went to break, we mentioned that you have actually been on the ground for 20 years. Describe the growth and impact of CFK over the last 20 years, Hilary.
Thank you very much. I would say ours has been a very natural growth from the two flagship programs that I talked about. And I earlier mentioned our contributions to various outcomes, especially in healthcare, education, and economic empowerment. And I would say this has not come with just success stories. I want to say that we have also made our mistakes, a lot of them, and learned from those ones, and collected information that is sufficient enough to propel us into the future, which is why we are now developing a plan that expands our work, either in terms of depth within the informal settlements, as well as additional numbers of informal settlements, and touching potentially 2 million people over the next 5 years. I would consider CFK probably the place you would go to if you needed information and you are interested in working in the informal settlements, in terms of just the data that we have collected, technical expertise and experience while working there. And as we celebrate these 20 years, we would want to welcome people who would wish to do work in the informal settlements to join hands in doing this.
Now, I hear you talk about economic empowerment. How have you been able to achieve this in the informal settlements?
So there are various ways of doing that. One way, you begin with an education. And my colleague Anne mentioned our program that provides scholarships for bright individuals within Kibera to further their education. Not just in primary, secondary, but also tertiary. And it's not just through our funds, but also partnerships with other people who are doing this. Once you have an education, then you prepare them for the job market. This would be either direct employment or self-employment. And we have hundreds of stories of success from young people who have grown out of these programs and are doing very well as far as economics is concerned.
All right. So even as we talk about the impact of CFK, how has research contributed to that impact?
So what we do is try to embed research in every project design and implementation. And the reason why we do this, one is just to inform the design of the project and how you will be able to measure the impact once you have implemented the project, but also the element of policy formulation at the national level. Right now, we have various local partnerships in research, and I would mention a few. We have had a long-term research partnership with Centers for Disease Control and Prevention, KEMRI, Washington State University here in Kenya, and local universities such as Kenyatta University. And the reason we are doing this is just to bring together people who would collectively develop what we call a body of knowledge, where people can go to when you needed information to hack the dynamics of informal settlements before you roll out any project. These institutions that I just mentioned, and including University of North Carolina, the School of Public Health in particular, are probably some of the best research institutions and have the best research capacities across the world, and we are proud to be part of that. I would give an example very recently. As at June 2021, our partnership with CDC and Washington State University carried out a study on seroprevalence. Just basically the presence of antibodies giving an indication that you may have an exposure, you may have had an exposure to COVID-19. And we established that 64% of the people who live in informal settlements have had that exposure. 87% of the households have had at least one positive case within those households. And you realize this information turned into policy briefs, then inform mitigation measures nationally, and not just in Kenya, but all informal settlements, because the circumstances are truly similar. But we are also using this information to now champion for vaccine access. And our facilities in Kibera have absolute capacity to provide that support to government.
And when you talk about other informal settlements, as Anne had mentioned, I mean, this is not something that is unique only to Kibera. Has CFK, you know, rolled out to other informal settlements? Are we feeling the impact of the same in these areas?
Yes. So as of 2021, we slowly started our expansion plan to additional informal settlements actually across Kenya. So we started off first by expanding within Nairobi. So what are these informal settlements that we feel we would be adding value through partnerships and to expand to that require some of our services and our initiatives. And then after that, we also expanded to additional counties. So we added an additional 7 of the existing 47 counties within Kenya. So our new 7 counties on top of Nairobi would be Mombasa, Kilifi, Machakos, Kajiado, Kiambu, Nakuru, and Kisumu. So those are the new areas that we are expanding into. Informal settlements, as I've said, quite similar. So those are so we are really excited to see how our impact is going to pan out. And as Hilary has mentioned before, it's the collective impact. That's what we are looking for, because we know we are not a one-stop shop for everything. But if we collaboratively work within all these informal settlements, we are definitely bound to see far more impact achieved.
Now, 7 counties out of 47 counties means you've left out 40. So what's unique to these 7 counties?
So actually it's 8 counties out of 47. Okay. So why we have chosen these counties? 3 main reasons. Number 1, all of these counties are hosting the currently fastest growing towns. So talk of Kiambu, talk of Mombasa. So basically they are the fastest growing towns are within these counties. Number 2, they have informal settlements that are quite similar in characteristics to Kibera. The only difference is a few counties have more of migratory aspect, kind of informal settlements, unlike Kibera that is quite permanent. A good example is Kilifi. The informal settlements tend to be a bit migratory, not long-term. But definitely the challenges, when it is in existence, are similar. And the third reason is also because of issues of strategic plan. So the counties all develop their strategic plans in terms of how they will develop these counties as they're developing, as they're being set up with devolution. And what we did is we compared the strategic plans with what we have. And quite a number of the areas lined up very well. So it shows that basically as you're plugging into this county, the county itself is also set up to support in what we are interested in. So basically collaboration is very easy. And I would say it's quite evident because we've been having a lot of meetings with the counties over the last 6-7 months. And conversations flow very easily because you are all in the same page. We understand where we are driving to, and it's quite easy to basically just plug in and support in the gaps that exist.
Now allow me to bring this off cuff. I mean, each of these counties have a unique characteristic you know, as far as their geographical, where they are based in. And have you seen the same as far as the needs that need to be met?
The needs slightly differ. Now the difference would be the how. So what you need, so what we need to think through is basically how do you slowly learn and adapt to a county as you enter. So our approach will be phased. We are not going to purport to be know-it-alls, where we will land tomorrow and the next day we have all our projects rolled out. We are busy within the community implementing. So you phase in. And the best way to phase in currently is first understand the community. So we are starting off with a lot of community level engagements, because basically it is the person, the people that make up the county. It is the household that makes up the village, that makes up the sub-county, that makes up the county. So if you understand the households, you will understand the challenges and the uniqueness, and then what we will do is just tweak the models to fit into what is unique within this counties.
Now, given the evolving needs in informal settlements, would you actually consider going beyond the counties, perhaps beyond Africa or rather Kenya?
Yes, yes, of course, that is definitely within the plan. The idea is learn as much as possible in the first 5 years, understand these 8 counties, and then now start exploring additional counties in the coming years. And our dream is hopefully in 10 years, we will be now having conversation on rolling out in new countries. And who knows, CFK will go to Africa or to the world.
Okay, so moving forward, I mean, it sounds like there's a lot of, you know, resources, financing that needs to go into this to realize that dream you have. And so my question is, moving forward, what kind of partnerships, I know you alluded to this earlier on, is CFK looking for to realize this?
In all these areas that we have operated, and even in our plans to expand, our #1 partner is always the community. They understand their needs and they can take part in finding solutions to those needs. So no one should ever go to a community and determine what they need without their participation. And that's what we have focused on over the last 20 years, and we will continue to do that. But meeting these needs, as you said, requires resources. And as my colleague mentioned, no single organization is resourced well enough to be able to cater for the changing needs among these communities. And so as we expand, we also know that it will not rely on brick and mortar, but rather on the existing partnerships and those that we seek to develop in those new communities to make that happen. And we are looking for implementing partners, coordinating partners, and people who would also advocate for causes that we believe in. I mentioned the work with community health volunteers and the need to support, say, informal schools in informal settlements. And because informal settlements are constantly changing, there's always a new thing in these informal settlements that needs to be tackled. We are now thinking of forming what we are calling a community of learning and collaboration among agencies and stakeholders that are interested in working in this sector, so that then we come together and get this work done.
Now, the pandemic has taught us a lesson or two. It doesn't matter which sector of society you are in. Would you say you've also walked away with a few lessons in how to rejig how you conduct a business?
We have several lessons. And I think even nationally, the closest we have come is very recently, until up to December last year, when the government and the coordinating agencies among government decided to bring together all stakeholders onto the table and have this discussion. And I think that went on very well and might have been the reason why we have seen low cases across the country.
And there are many players in these counties that you're getting into. As you're saying, you're not the first to do this, but there's something the CFK offers that's unique. Which is it, Anne?
Our uniqueness is, #1, we are very community driven. So we are an organization that is open to learn, that is open to hear, and we value the feedback. So as much as possible, we definitely walk every single step with the community to understand their model, to understand their needs so that we respond accordingly. #2 is we basically utilize a holistic approach. We understand that as an individual, you have multiple needs and they will all require multiple areas of addressing. So you have educational needs, you have health needs, you have mental health needs. You have needs to address basically also challenges that you have as an individual. You have needs to earn an income. So our programs collectively actually just address an all-round aspects of what makes an individual basically enjoy the quality of the life that they would want. In addition to that, also we are very open to partnerships. We believe, as we keep mentioning, we really embrace our collective impact. So how can we all just work together to make the change that is needed within these communities?
Yeah. Hilary, would you say, even as we think about partnerships, that perhaps the devolved governments have come to help along the processes of realizing these dreams you have for the informal settlements across board?
Indeed, they have. And I will also add to what my colleague Anne said. One of our uniquenesses is that we don't patch and leave. We value community engagement, we value development of trust among the people that we serve, because they take ownership of running those projects and you realize the desired results. And we are out there to change the mindset and not just leaving a footprint, as we have always argued. Indeed, the government, and especially in Nairobi, I would quote the NMS, have done quite a lot of work towards universal healthcare. Right now, there is construction going on of about 24 facilities in informal settlements across Nairobi. And I have seen the developments, including in Kibera and other informal settlements where we work, that construction going on. And that's likely to fill a very huge gap that has existed in terms of access to healthcare within a reasonable distance, open throughout, and they are well stocked so that people who go there get what they're looking for. But I would say two things. There is building them and having structures in place, but there's also making sure that you operationalize them in a sustainable manner. So a plan needs to be put in place, and I think this is where players such as Carolina for Kibera also come in to support NMS and government to make sure that these facilities continue to run in a manner that they should. But the second one is also an investment in community health volunteers. For me, I'm very passionate about this cadre of people and the work that they do in terms of promoting healthcare, making referrals and making sure that people get to hospitals before treatment becomes expensive, and also continuous involvement in sensitization on guidelines set by government, including right now, now that we have a pandemic, and a lot needs to be done at that particular level. So investments in these sectors would change how healthcare is viewed and perceived by the people that we serve.
Okay, and speaking of investments, I mean, how can I be part of CFK now that you say you are very open-minded to partnerships? I'll start off with you, and even as we bring the discussion to a close.
So what we would say is we welcome any individual, any corporation, any institution that would love to collaborate, learn more about us, and just partner in our various initiatives. So feel free to reach out to us through our website, our social media pages, just Carolina for Kibera Crossport, and possibly also if you'd love to drop us an email, feel free, info at carolinaforkibera.org, and we will definitely start the conversation and figure out what works for both parties and where we can work together.
And I guess the best incentive here would be, what are your immediate needs?
Our immediate needs currently, when it comes to issues of education, those are an immediate need. How can we collaborate to provide basically access to education, as Hilary has mentioned? So issues of quality improvement within the schools, that is very prominent. Issues of just basic things like school fee, how can we work together? When you're coming to the health sector, Hilary has mentioned issues of the community health volunteers, the CHVs. What we have, it is a really wide and robust group of individuals. So it's actually a strategy under the Ministry of Health that has also been devolved to the counties. And what you see is that the need that currently that we would really love is to have partners who want to come work with us in supporting that particular structure and having it running. So what we have in most of the counties we have visited is that the CHVs, their strategy itself, it has been set up. So they've recruited and slightly trained a few of the CHVs. But the CHVs, there's an entire curriculum they have to go through. Most of them are not finished that. So we need support to take them through all those curriculums. They need supplies to conduct their home visit and basic service delivery within the community. So how can we do that? And a few supplies that they need also when it comes to training. So those are some of the most urgent needs that we need. And lastly, of course, we can never forget the girls. I'm told to be a bit impartial. It's true, because I feel the girls really need someone to stand by them. And anyone who's willing to stand with us with issues of education for teenage mothers, menstrual hygiene is really critical. The government has gone a long way in providing in schools, but what we realize is it's not yet enough. And what we don't realize is in the public schools, they have the sanitary towels, but we have a huge chunk of our girls that go to informal schools. They are not part of the supply chain. They are left out. And we work with quite a huge number of those. So anyone who's willing to work with us and supporting the girls, especially that supply chain, we would love that, and especially exploring additional out of school options. We have a very interesting, if I could mention quickly, it's called MHM Labs that we would love to set up in these counties, where basically it's a all-encompassing menstrual hygiene focused room or facility where you come and learn, and there are basically all the supplies that you would think of that you'll be able to plug in. And the best thing, it accommodates both boys and girls because we value involvement of boys and men when any issues that addresses girls or women.
Excellent. So 20 years on, I mean, Hilary, that's a long time and the impact speaks for itself. So how can partners join in and help you along in the next 20?
I would say, and probably emphasize on the issue of creating long-term partnerships, making sure that we achieve the needs of the communities that we serve. And the reason why I'm very focused on this one is that we need to begin to work towards collective impact, that we shouldn't compete, but we should collaborate to realize maximum impact in these communities.
All right, well said, and quite an informative conversation even as we understand how to better safeguard the informal settlements in this country. Hilary Omala, Executive Director, CFK, and of course Anne Kongo, Partnerships and Fundraising Manager at CFK. Thank you for your time. Before I bid you farewell, I'm told we need to take a look at the other world, and Gazans queue to receive their COVID-19 vaccines at the Square of the Unknown Soldier in Gaza City, one of more than 40 vaccination points throughout the region. Now, the Gaza Health Ministry spokesperson said so far the vaccination rate for the target group has reached over 21%. There is a high demand from citizens. Palestinians have become more aware and conscious about staying healthy and protecting others. Ali Al-Qadi, a Gazan, adds that vaccination has become easy and is accessible everywhere in parks and public areas. Mohammed Suleiman says he goes on to add that today it's our duty to be vaccinated in order not to affect those around you at work. You must be vaccinated in order to travel or to use governmental, local or foreign services, and you must have a vaccination certificate. Elsewhere, the remains of people believed to be the victims of Stalin's terror have been discovered in Ukraine's southern city of Odessa. According to various estimates, the bones of between 5,000 and 20,000 lie in the ground, making it one of the largest mass graves unearthed in Ukraine so far. Tatiana, a chief consultant archaeologist, says this was the area of the old city dump. The most cynical part of it all is that the perpetrators dug out these pits from under a layer of rubbish. They threw those people in there, or perhaps they were shot fast, and it is still hard to say at this point, and then covered them with rubbish again. Now, the mayor of Odessa points out that there is a data in the archives of the Interior Ministry of the Soviet Union of those people who were actually shot there.
Ярославский завод резинотехнический.
Palestinians burned tires during a protest along the border fence with Israel east of Gaza City in the central Gaza Strip, demanding an end to Israel's blockade and the right of Palestinians to return to lands they fled or were expelled from when the Jewish state was founded. We want to live freely. Without freedom, we will continue to annoy them day and night until morning, said one of the protesters. As an official of the Islamic Jihad movement in Gaza City added that we say to this enemy, this protest came to confirm that our Palestinian people are not afraid of the threats of this enemy, and that these people deserve life and to live a dignified life on this land without siege and without killing. Well, that's it from us here on Your World on this last day of August. But before I bid you farewell, the UN Food Systems Summit is scheduled for the 23rd September in New York. Now, the summit will be setting the stage for global food systems transformation to achieve the Sustainable Development Goals by 2030. Now, with food security top of mind globally, especially in the midst of this pandemic, what does this mean for Kenya? Victor Kiprop will be interrogating this tomorrow from 7 a.m. See you then.
Thank you.